Good day everyone. Our topics is all about hearing impairment, but let's first discuss or define what is hearing impairment. Hearing impairment. Hearing impairment is defined as impairment in the hearing, whether permanent or fluctuating, that adversely affects a child's educational performance. Hearing. So what is hearing? Hearing or auditory perception is the ability to perceive sounds through an organ, such as an ear, by detecting vibrations as periodic changes in the pressure of surrounding medium. So hearing refers to our ability to see or hear noise and sounds. We use our hearing to listen to music, talk to people around you, and assess social and environmental situations. While impairment is the state of being diminished, weakened, or damaged, especially mentally or physically. Impairment prevents someone from doing something, like how an eye injury can be an impairment to seeing. An impairment can also be any change for the worse. People with impairments have trouble doing something. A brief history of hearing impairment. So the history of hearing impairment can be tracked back to the centuries before Christ BC. For instance, around 1000 BC, a Hebrew law provided those with deafness and hearing impairments limited right to own property and marry. Nonetheless, although this law protected people with hearing impairments from being cursed and maltreated by others, it did not grant them full participation in rituals for the temple. So in 100 BC, binigyan ang mga bingi or hearing impairment ng limited rights na magkaroon ng ari-arian at magpakasal. People with hearing impairments were considered to be subnormal by great philosophers of that time. For instance, between 427 and 347 BC, Plato's philosophy or innate intelligence was the vacuum. It claimed that all intelligence was present at birth. Therefore, all people were born with ideas and languages in their minds and required only time to demonstrate their outward sign of intelligence through speech. People with hearing impairments could not speak and were therefore considered incapable of rational thought and ideas. In 355 BC, Aristotle was reported to have claimed that those who were born deaf would become stupid and incapable of reason. According to him, people with hearing impairments could not be educated because without the ability to hear, people could not learn. Greek, which was spoken in society, was considered the perfect language, and all people who did not speak Greek, including people with deafness, were considered barbarians. Sign language used by 10th century monks. Plato's writings give us our first reference to a sign language used by mute people. The earliest record of a specific sign comes from 10th century monks in Burgundy. In order to keep their strict vows of silence, the monks created a collection of hand signals that allowed them to communicate without speaking. Witnesses of this language noted that the sign would have been sufficient if they lost the use of their tongues. The language became known as Cluniac Sign Language and had significant impact on monastic life in Europe. It is also thought to be the inspiration for Ponce de Leon manual alphabet or finger spelling developed at the first school for the deaf in the mid-1500s. Early hearing aids. There is evidence of Roman consul Hadrianus cupping his hand behind his ear to hear better, but the earliest mention of hearing device comes in the 1588 writings of Italian scholar Giambattista della Porta, which describe a horn-like instrument, modeled after the ears of animals, which could help amplify sounds. The first ear trumpets were created by Paolo Apronio, one of the Galileo's students in the 1610. Ear trumpets did not become popular, however, until the end of that century. So, there is ample written evidence for the treatment of hearing loss, the use of early sign language, hearing instrument of some changing perception towards deaf people dating back to 3,500 years ago. How do we hear? Sound waves enter the outer ear and travel through a narrow passageway called ear canal, which leads to the eardrum. The eardrum vibrates from the incoming sound waves and sends this vibration to three tiny bones in the middle ear. The bones in the middle ear amplify or increase the sound structure filled with fluid in the inner ear. An elastic partition runs from the beginning to the end of cochlea, splitting it into the upper and lower part. This partition is called the basilar membrane because it serves as the base or ground floor on which key hearing structures sit. So once the vibration causes the fluid inside the cochlea to ripple, a traveling wave forms along the basilar membrane. Hair cells, sensory cells sitting on top of the basilar membrane ride the wave. Hair cells near the wide end of the snail-shaped cochlea detect higher pitched sound, such as an infant crying. Those closer to the center detect lower pitched sound, such as a large dog barking. As the hair cells move up and down, microscopic hair-like projections known as stereocilia that perch on top of the hair cells bump against an overlying structure and bend. Bending causes pure-like channels, which are the tips of stereocilia, to open up. When that happens, chemicals rush into the cells, creating an electrical signal. An auditory nerve carries this electrical signal to membrane, which turns into a sound that we recognize and understand. So we have three types of hearing impairment. Number one is conductive hearing loss. Conductive hearing loss happens when the natural movement of sound through the internal ear or middle ear is blocked, and the full sound does not reach the inner ear. Conductive hearing loss results when there is any problem delivering sound energy to your cochlea. The hearing part in the inner ear, common reason for conductive hearing loss include blockage of your ear canal, a hole in your eardrum, problems with the three small bones in your ear, or fluid in the space between your eardrum or cochlea. So one of the symptoms of conductive hearing loss is muffled hearing. Different factors can contribute to a clogged ear. Some cases are minor and resolve quickly, but others require medical attention to protect hearing. Second type of hearing impairment is sensorineural hearing loss. Hearing loss is caused by dysfunction of the inner ear, the cochlea, auditory nerve, or brain damage. This kind of hearing loss is normally due to damaged hair cells in the cochlea. As humans grow older, hair cells lose some of their function and hearing deteriorates. Sensorineural total deafness may occur as a result of congenital deformities, inner ear or infections, or head trauma. Sensorineural hearing loss is also caused by damage to these special cells or to the nerve fibers in the inner ear. Sometimes the hearing loss is caused by damage to the nerve that carries the signals to the brain. Sensorineural deafness that is present at birth, loss in trouble to hearing sound when there is background inside background noise. The last type of hearing impairment is mixed hearing loss. Mixed hearing loss has elements of both conductive hearing loss and sensorineural hearing loss. This means there is damage to both the outer and inner ear. The outer ear cannot conduct sound properly to the inner ear, and the inner ear can process the sound to be sent to the brain. The sensorineural component or the inner ear is usually permanent, but the conductive hearing loss or the outer ear may not be. Many people with mixed hearing loss experience sound as very soft and volume and difficult to understand. So that's are the three types of hearing impairment. Next is age of hearing impairment, which will be discussed by Miss Angeline Gamoso.
So we have a 4 degree of hearing loss: mild hearing loss, moderate hearing loss, severe hearing loss, and profound hearing loss. So what is the mild hearing loss? A person with mild hearing loss may hear some speech sounds, but soft sounds are hard to hear. It is classified as hearing loss of 26 to 45 decibels of audiogram. It has mild impact on communication. Person can be able to listen other person if he or she is near to him, but can face difficulty if he is little far. They do not find difficulty in normal conversation, and there are many hearing aids that they can use. Moderate hearing loss. A person with moderate hearing loss may hear almost no speech when another person is talking at a normal level. It is classified as a hearing loss of 45 to 55 decibels on audiogram, and they can barely hear speech at conversational level on quiet environment. They have a difficulty in normal conversation and hearing sounds at a distance. They may or may not be able to understand that is being said. Hearing aids are required here. Third is the severe hearing loss. A person with severe hearing loss will hear no speech when a person is talking at a normal level and only some loud sounds. It is classified as hearing loss of 71 to 90 decibels on audiogram. They can hear louder sounds at a distance close to ear. They are required to have hearing aids in order to learn and to hear. And the last is the profound hearing loss. A person with a profound hearing loss will not hear any speech and only very loud sounds. It also classified as hearing loss of 90 to 100 decibels on audiogram. Child likely responds to more on vibrations than sounds. They are able to hear only amplified speech. Some do not hear at all, even with aids. So the child may or may not take beneficial from hearing aids. How hearing loss occur? First is the damage to the inner ear. It occurs over time. Aging and exposure that too loud noise may cause wear and tear of the hairs or the nerve cells in the cochlea that send sound signals to the brain or the audio nerve. When these hairs or nerve cells are damaged or missing, electrical signals are not transmitted as efficiently and hearing loss occurs. Higher pitch tones may become muffled to you, and it may become difficult for you to pick up words or to pick out the words against background noise. Second is the gradual build-up earwax. Earwax can block the ear canal where you can hear and prevent the conduction of sound waves. If the earwax is removed, it can help restore your hearing. It occurs when existing wax pushed too far into your ear canal. For example, marami akong napapanood sa mga social media gaya ng YouTube and Facebook na ina-explain nila na if you try to get the wax out with the use of cotton buds or cotton swab, you may ended up pushing it further into your ear. Third is that ear infection and abnormal bone growths or tumors. In the outer or middle ear, any of these can cause hearing loss. Temporal tumors are usually caused by a tumor that begins on the skin near the ear and later spreads to the bone. And fourth, that hearing loss can occur is the ruptured eardrum or the tympanic membrane perforation. So if the loud blast of noise sudden changes the pressure, poking your eardrum with an object, and infection can cause your eardrum to rupture and affect your hearing. This ruptured eardrum, it is a hole or a tear in the eardrum. If the rupture is very large, your eardrum may not translate any sound waves to the bones in the middle ear, which results in hearing loss. So next are the risk factors. So what are the factors that damages or lead to lose your hair or nerve cells into your inner ear? First is the aging. The degeneration of inner ear structures occurs over time. When you are getting older, it affects your hearing and it causes to loss of hearing. Majority are those over 60 years of age and certainly those over 70 years old. It is the common cause of hearing loss. Second is the loud noise. Exposure to loud sounds can damage the cells of your inner ear, and damage can occur with long-term exposure to loud noises. When you are exposed to excessive noise, such as listening to loud music using your earbuds or earphones, it generally considered to be the second most common cause of hearing loss. And also from a short blast of noise, such as from a gunshot. Third is the heredity. Your genetic makeup may make you more susceptible to ear damage from sound or deterioration from aging. So hereditary or genetic hearing loss does not always mean a person is born with it. This is a factor for some people as when age-related hearing loss begins to occur and may even mean some people are more susceptible to hearing loss from noise exposure. Next is the occupational noises, where loud noise is a regular part of the working environment, such as in farming, factory work, construction, that can lead to damage inside your ear. Next is the recreational noises. Exposure to explosive noises such as firearms and jet engines that can cause permanent hearing loss, or other recreational activities with dangerous high noise levels. It includes the snowballing, motorcycling, carpentry, and or listening to loud music. Uh, Next is the some medications. Some medications are known to cause sensorineural hearing loss, and these are called ototoxic drugs. Even aspirin can cause hearing loss if taken in regular. Drugs as the antibiotic gentamicin, Viagra, and certain chemotherapy drugs can damage the inner ear. Last is the sub-illness, diseases, or illness that result in high fever, such as meningitis, may damage the cochlea. It also in infectious disease, or the bacteria and the disease in chickenpox. It also in cardiovascular disease due to unhealthy lifestyle, and hearing can be affected here by a poor diet and smoking and lack of physical exercises. So those are the factors that affect your hearing loss, or the factors that damages your inner ear. Symptoms. So what are the signs and symptoms of hearing loss? It may include, first, muffling of speech and other sounds, delayed speech and communication developing, difficulty understanding words, especially against background noise or in a crowd. So here, hirap silang umintindi ng salita, or hirap nilang intindihin kapag sila ay nasa crowded area at kapag maingay, ganon. Trouble hearing consonants. So, without being able to hear subtle differences between consonants words like cat or hat, so they are confused in the word of same sound. Frequently asking others to speak more slowly, clearly, and loudly. They are asking others for things to repeat what they are saying. Needing to turn up the volume of the television or radio. So when the child or your child are watching TV, or sometimes he or she watching on your smartphone or cell phone, they increases the volume so that they can hear it and understand what they are watching. Withdrawal from conversations. Avoidance of some social settings. Because of the symptoms, you are avoiding social situation because you are irritated hearing very loud or very noisy, or kung ano-ano pa yung naririnig mo kung saan-saan. And another sign is you're not being able to understand what others says. So those are the signs and symptoms of hearing loss. Next are the hearing loss that affects emotional health. Those are the anger and denial, depression and anxiety, isolation and social withdrawal, and fatigue. In anger and denial, losing your hearing can be a drastic change to your everyday life that can be a difficult adjustment to get used to, causing feelings of anger. It's also common for people with hearing loss to be in denial, about the severity of their hearing loss because it is a change that is hard to accept. Second is the depression and anxiety. Losing your hearing make you feel like you lost part of your identity and can cause feelings of sadness and depression. Symptoms of depression can include crying, slowed responses, weight changes, and disrupted sleeping pattern. Hearing loss can also be anxiety-provoking. When someone with hearing loss is faced with having a conversation with someone else, it can create a lot of stress and worry that they are going to miss parts of the conversation and let on that they are struggling to hear. Next is the isolation and social withdrawal. It is common to avoid situations where it is difficult to hear in order to avoid feelings of stress, anxiety, and embarrassment feelings about your hearing loss. Isolation and social withdrawal can also lead to feelings of depression or make them worse. The frustration of not being able to hear in this situation may lead people to avoid going out in public or meeting up with family and friends, which can sadly cause them to become socially isolated. Lastly is the fatigue. Losing your hearing can make you feel tired all the time or fatigue because straining to hear properly demands more of your energy. So people with hearing loss often feel physically exhausted at the end of the day from the strain of trying to hear and make sense of what people are saying because of all the additional work that is involved in hearing. So that are the hearing loss that affects emotional health. Next is the diagnosis. So what are the tests or exams you are going to diagnose a person or a child or an individual that has or have hearing loss? It includes physical exam, general screening test, app-based hearing test, tuning fork test, and audiometer test. In physical exam, your doctor will look to your ear for possible causes of your hearing loss, such as earwax or inflammation from an infection. And also your doctor look for any structured causes of your hearing problems. Next is the general screening test, where your doctor may use the whisper test and asking you to cover one ear at a time to see how well you hear words spoken at various volumes and how you respond to other sounds. Next is the app-based hearing test with the use of mobile phone or cell phones. Those are the mobile apps are available that you can use by yourself on your tablet to screen for moderate hearing loss. Next is the tuning fork test. Tuning forks are two-pronged metal instruments that produce sounds when struck, and simple tests with tuning forks can help your doctor detect hearing loss. This evaluation may also reveal where in your ear the damage has occurred. Last is the audiometer test. During this more thorough test, conducted by all audiologists, you wear earphones and hear sounds and words directed to each ear. Each tone is repeated at faint levels to find the quietest sound you can hear. Lastly, the treatments. So what are the treatments you are going to do to lessen your hearing loss? So the treatments for hearing loss is depend on what's causing it. Sometimes it gets better on its own or can be treated with medicine or simple procedures. So what are the treatments you are going to do? So here are the treatments: removing wax blockage, surgical procedures, hearing aids, and cochlear implants. In removing wax blockage, earwax blockage is a reversible cause of hearing loss. Your doctor may remove earwax using suction or a small tool with a loop on the end. Here, in removing wax blockage, your doctor can remove excess wax using a small curved instrument called a curette, or by using a suction while inspecting the ear. Your doctor can also flush out the wax using a water pick or a rubber bulb syringe filled with warm water. Alternative medicine is that some people use ear candling. That is a cone-shaped candle that placing into the ear to try remove earwax. Next is the surgical procedures. Some types of hearing loss can be treated with surgery, including abnormalities of the eardrum or bones of hearing. If you've had repeated infections with persistent fluid, your doctor may insert small tubes that help your ears drain. So here your doctors perform this procedure using general anesthesia. So we all know without anesthesia, we can feel the pain during the procedures. So the surgeon make a small opening in the bone behind the ear to access inner ear, where they install a series of tiny electrodes, and also they close it with stitches or staples. Next is the hearing aids. If your hearing loss is due to damage to your inner ear, a hearing aid can be helpful. So they are small electronic devices worn in your ear that make sounds louder and clearer, although they will not give you back your full hearing. So an audiologist can discuss with you the potential benefits of a hearing aid and fit you with a device. Open fit aids are currently the most popular due to the fit and features offered. Lastly is the cochlear implants. Here a cochlear implant may be an option if you have severe permanent hearing loss that is not helped by hearing aids. So unlike a hearing aid that amplifies sounds and directs it into your ear canal, a cochlear implant bypasses damage or non-working parts of your inner ear and directly stimulates the hearing nerve. So before having a cochlear implant, you'll have an assessment to find out if it will help. So the implant will only work if the nerve that sends sound to the brain or the auditory nerves is working properly. So an audiologist, along with a medical doctor who specializes in disorders of the ears, nose, and throat, can discuss the risks and benefits. So that's are the treatment that you and the others that having a hearing loss can be treated. So that's all our discussion about the hearing impairment. Thank you. I hope you get a lesson from our discussion.